Hello, Mr. and Mrs. JB. My name is Tiffany. I will be your nurse and we will be going over your discharge medications. It looks like you came into the hospital because you were having some headaches, vision changes, a lot of urination, and just wasn't feeling well. So I'm sorry to hear that. It looks like your blood pressure has been pretty high lately. So your provider did prescribe two blood pressure medications that we will go over. And it also looks like you're newly diagnosed with type 2 diabetes, and there's also a medication prescribed for you for that, and we will also go over that medication as well. So the first medication that was prescribed for you is called Lepressor. It's also known as metoprolol. This was prescribed for you at 50 milligrams that you'll take by mouth daily. So that's just one pill by mouth a day. So with this medication, it will be used to help lower your blood pressure. It also could lower your heart rate as well. Do you have a blood pressure monitoring clip at home? You do? Okay, great. So it's a really good idea to keep a log at home of your blood pressures to kind of keep an idea if you're right in range or if it's just not helping and you're staying pretty high. So that way down the road, if adjustments need made, your provider can definitely do that for you. So before taking this medication, you would want to take your blood pressure and monitor and see where you are at. If your top number of your blood pressure reading is below 90, or if your heart rate is less than 60, you would want to hold a dose of metoprolol just because we wouldn't want your heart rate or your blood pressure getting much, much lower. The other thing with any blood pressure medication is slow position changes. So when you're first getting up in the morning and you're laying down, instead of jumping right on up, it's a good idea to kind of sit on the edge of the bed, kind of let your feet dangle for a little bit before getting up. So that way you're not feeling dizzy or lightheaded and then have a risk for falling or any type of injury. And then same thing, when you go to pick something up, try not to bend directly over and just kind of like do a 2 feet stance, squat down, and grab what you need. The other thing with metoprolol is because it lowers your blood pressure, we're hoping to see that change from your baseline, which is pretty high, and then also monitor for any shortness of breath or chest pain. If either of those were to occur, I would recommend that you call your provider and let them know, or if you're really having much difficulty breathing, call 911 and get to the emergency department. Because of your new diagnosis of type 2 diabetes, metoprolol can help. It will cover those low blood sugar symptoms that you would typically get, like the fast heart race. So just keep an eye out for any dizziness, confusion, excess hunger, sweating, those types of things to let you know, okay, maybe my blood sugar is getting a little low and I should check that. So just be mindful of those things when taking metoprolol. The other blood pressure medication prescribed for you is called Zestrol, also known as lisinopril, and this was prescribed for you at 10 milligrams daily. Lisinopril, again, also a lower blood pressure medication. So again, with that slow position changes, very important. You don't want to get up too quick and then your blood pressure drops and then we start feeling dizzy, lightheaded, and off. With lisinopril zestrol, a common side effect that people usually see with this medication will be that dragging cough. It's really naggy, it doesn't go away. It can also cause high potassium levels, so you would also want to keep an eye out for like any muscle weakness, any urine abnormalities, anything along those lines, and let your provider know. You also have potassium levels monitored through blood work to kind of keep an eye on that to make sure that your potassium isn't getting too high. Another side effect with lisinopril is angioedema, and this would be swelling of your face, lips, mouth, your tongue even. So keep an eye out for that. If that occurs, please let your provider know if you cannot breathe because the swelling is so bad. Call 911 so that way they can get you to the ED and get managed. Um, Also, you want to avoid any NSAIDs, so that's like your Aleve, your Advils, and only because that can decrease the effectiveness of your lisinopril, so it just won't work as good. Um, so let's avoid those medications as well as, again, keeping an eye on any difficulty breathing that you may have. Okay. The other medication that was prescribed for you is called glucophage, also known as metformin. This was prescribed at 500 milligrams daily. So you can take this in the morning. When you're taking metformin, we could also think about incorporating an exercise program, a healthy diet that lower those blood sugar levels a bit. Um, Walking is a great start, any swimming, anything like that to kind of get your body moving. You would want to monitor for any nausea, vomiting, diarrhea with this medication. You may even experience a metallic taste in your mouth. If that occurs, becomes too much of a nuisance, you are welcome to call your provider and make them aware of that. You want to avoid any alcohol only because this medication can cause some additional symptoms such as like fatigue, lethargy, weakness, those types of things. And if any of that were to occur, if you did start drinking, you would just want to make your provider aware just so they can keep an eye out for that and make sure it doesn't get worse because of some of the adverse effects that can occur with that. Did you have any questions in regards to any of the medications that we went over today? No? Okay, great. Thank you.